Hello and welcome to Askimo TV. I'm talking today to Dr. Bruce Okoye. Dr. Okoye is a consultant paediatric surgeon at the St. George's Hospital in London, the Royal Marsden Hospital, and the Portland Hospital for Women and Children. He specializes in all aspects of pediatric surgery, but particularly in surgery for childhood tumors. Hi, Dr. Okoye, how are you?
I'm fine, thank you. How are you?
Very well, thank you. Dr. Okoye, today's discussion is going to be about gastroesophageal reflux. So let's begin with what is gastroesophageal reflux?
Well, I can answer the question by with some anatomy. When the food goes in through the mouth, then it goes down the esophagus, which is the tube that connects the mouth to the stomach. The food then goes from the esophagus into the stomach and then down into the rest of the intestine. Now, the junction between the esophagus and the stomach needs to be quite robust and tight to stop food regurgitating back up the esophagus. And when we have excessive amounts of food, or in the baby milk, rather than staying in the stomach, coming back up the esophagus, then that is gastroesophageal reflux.
What causes gastroesophageal reflux in children, and are some children more at risk than others?
Well, most children, most normal babies will have some degree of gastroesophageal reflux within the first 3 to 4 months of life. So I'm sure you'll know that, very often when you give a baby a milk feed, then they may regurgitate up a little bit of milk, and that is quite normal. Some children, however, do have more severe forms of reflux, and that may be because they have an anatomical abnormality like a hiatus hernia, which is a gap in the diaphragm, and this may predispose to reflux. And more rarely, normal children can have severe reflux. But children with severe neurodevelopmental delay, or children who have cerebral palsy or severe epilepsy, these children are particularly at risk for severe gastroesophageal reflux. And we think that is because of abnormalities between the nerve pathways between the brain, the esophagus, and the stomach.
What are some of the complications associated with gastroesophageal reflux?
Well, like I said earlier, most normal children will have some degree of reflux, and if that is mild and they're just bringing up small amounts of milk, then often that is a self-limiting condition and requires no treatment. But as the grade of reflux increases, then children can fail to thrive or fail to grow normally simply because they are vomiting or regurgitating more of their milk than they are taking in. But also, if food is coming up in an uncontrolled fashion from the stomach up the esophagus, then that can spill over into the lungs and cause severe aspiration pneumonia. Sometimes the acid coming up from the esophagus, from the stomach into the esophagus, can cause very severe inflammation, and this can cause quite significant bleeding from the esophagus. And sometimes the inflammation of the esophagus can be so severe as to cause narrowing or scouring, which can then make it very difficult to actually swallow, and that's called dysphagia. So these are some of the complications that can happen with gastroesophageal reflux.
And what should we be aware of when looking at, for example, the color of what the child is bringing up?
So it's very important before attempting to treat or make a diagnosis of gastroesophageal reflux to distinguish gastroesophageal reflux from other causes of vomiting. So as you can imagine, in a child, they can vomit for 101 different reasons, from a chest infection to a cold. But what is really important, as you pointed out, is to note the color of the vomit. So if at any time your child vomits anything that is green or bilious, then you need to seek urgent medical opinion, because green vomit usually signifies a more severe obstruction of the intestine. The particular one that we worry about as pediatric surgeons is something called malrotation of the intestine, where the bowel can twist completely and the baby can potentially lose all its intestines. So it's really important to point out that green vomit is not gastroesophageal reflux and needs an urgent referral, whereas the vomit with reflux is often just feed or clear or yellow fluid.
If gastroesophageal reflux is severe, what treatment options are available?
So in this era, there are very powerful drugs which can control gastroesophageal reflux. So the vast majority of children with reflux, the symptoms can be managed with drugs. So most commonly we use the kind of drugs adults will use for heartburn, like ranitidine or omeprazole. And these are drugs which control the acid that is coming up from the stomach, and so they can modify the symptoms significantly. And also we can give drugs which help the stomach to empty properly and the esophagus to empty properly. So the vast majority of reflux can be managed with drugs, and in most babies, they grow out of reflux. So even those who have quite significant reflux, as they grow up and spend more time on their feet, or as their feet become more solid, then the reflux tends to get better on its own. However, in severe cases, surgery unfortunately is unavoidable, and so we treat this with an operation called a fundoplication, and these days we can do this using mainly keyhole surgery quite successfully, and for the right patients, then that is a very good operation to do.
Thank you, Dr. Okoye. Thank you so much for talking to me today.
Thank you.